Good morning, everyone. Welcome to this, the 24th meeting of the Joint Select Committee on Social Services and Public Administration. I would like to welcome this morning all of our viewers and listeners on the various Parliament's social media platforms, the Facebook, the Twitter, ttparliament.org, the Parliament's YouTube channel, ParlView, our various media fora. I welcome everyone and I invite them to send in whatever questions they may have to the Secretariat during the course of the hearing this morning. I would like to welcome our representatives before us, but before I do that, I would like to indicate to everyone assembled this morning that this is our committee's first public hearing pursuant to our inquiry into the potential benefits of non-traditional medications in the treatment of non-communicable diseases in Trinidad and Tobago. This is a very broad subject. We would seek to narrow the focus as we proceed, and we will be posing the questions that are relevant at this time with the understanding that we will have to continue the taking of evidence in subsequent hearings. At this point in time, I would like to ask the members of the panel and the representatives who are here with us this morning to introduce themselves briefly. And may I start with the Ministry of Health.
Good morning, Chairman and members. I'm Richard Madre, Permanent Secretary, Ministry of Health.
Thank you very much, Mr. Madre, and good to see you again before our committee.
Good morning, Chairman and members. I'm Dr. Brian Armour. I'm the Acting Chief Medical Officer of the Ministry of Health.
Hi, good morning, Mr. Chairman and members. Fascan, the Director of Chemistry, Food and Drugs, Ministry of Health.
Yes. And we have other representatives? Oh, okay. Yes.
As LeBlanc, General Practitioner, Medical Herbalist, and a member of the Subcommittee for Herbal Medical Medicine.
Thank you. Yes. Now we have officials of the Faculty of Medical Sciences at the UWI. Please introduce yourselves.
Yes, morning, sir. Terence Simangal, Dean of the Faculty of Medical Sciences.
Thank you very much, Professor Simangal.
Chair and members, Yuri Clement, Professor of Pharmacology at UWI.
Thank you.
Good morning to the Chair and to the members. I am Valerie Seeley Tobias. I'm Assistant Lecturer at the UWI School of Nursing.
Thank you. Lecturer in what medicine? Avian medicine. Avian medicine refers to birds. Very well. Thank you very much. Yeah.
Representing the School of Pharmacy.
Okay, thank you. Are there any other representatives? Faculty of Science and Technology.
Good morning, Chairman and members. My name is Jairaj Jayaraman. I am Professor of Biotechnology and Plant Microbiology at the Department of Life Sciences, Faculty of Science and Technology, UWI St. Augustine.
Oh, thank you, sir.
Thank you.
Other representatives, yes? Good seeing you, Ms. Bakshkomo. Before the committee, yes.
Yes, sir.
Good morning, Chairman.
An official from the pharmacy board is here with us this morning, I understand.
Yes, I am Andrew Rahman. I am the president of the Council of the Pharmacy Board of Trinidad and Tobago.
Right. At this point in time, I would like to invite members of the committee to introduce themselves before I ask the representatives of each of the organizations here this morning to offer us brief opening remarks, brief 1 minute, maximum 2 minutes opening remarks, and then we proceed with the full inquiry. So may I start with my right? MP? Yes.
Brigadier General Ansel Antoine, Member of Parliament, member.
Esmond Ford, Member of Parliament for Tunapuna, Deputy Chairman of the committee.
Yes. Senator?
Good morning. My name is Khadija Amin. I'm an opposition senator and a member of this committee.
Good morning, Alison West, Senator and Minister in the Ministry of Finance.
And I am Dineshwar Mahabir, Independent Senator, Chairman of the committee. Before I ask representatives to offer us brief opening remarks, may I remind all stakeholders about the objectives of our inquiry. First objective, to determine the views of medical professionals. And by medical professionals, I mean all individuals, whether they are registered with the medical board or not, once you are researching in the field of medicine, I will consider you a relevant professional. To determine the views of medical professionals on the potential benefits of non-traditional forms of treatments, such as acupuncture and Ayurvedic treatments in the treatment of non-communicable diseases. 2, to determine whether research has been conducted by the Faculty of Medical Sciences, and may I add, other areas in Trinidad and Tobago, UWI, on the benefits of non-traditional medication, on items such as aloes, orange peel, ginger, turmeric, green pawpaw, etc., things which have traditionally been used in Trinidad and Tobago are not necessarily prescribed by medical professionals. 3, to determine whether over-the-counter items such as omega-3, CoQ10, black cohosh, St. John's wort, etc., are recommended by registered medical practitioners, and under what circumstances. 4, to determine whether homeopathic treatments are used by established doctors and whether persons offering such treatments should be registered by the Medical Board of Trinidad and Tobago. 5, to determine whether organic medications based on bacteria, enzymes, and plants can contribute to improving the health status of the population. And 6, to examine existing and possible arrangements for regulating the use of alternative medical treatments in Trinidad and Tobago. The objectives are very wide. The objectives are very broad. This is fully understood by the committee. Our purpose this morning would be to really get to the truth in this broad area and to chart the way forward so that ultimately the health status of the people of Trinidad and Tobago can be protected and can be promoted. And we have come to this inquiry because we need to find the truth with respect to current information that is held by the practitioners, the registered practitioners in Trinidad and Tobago. So I would ask at this point for brief opening remarks from the representatives of the various organizations. And may I start with the Permanent Secretary, Mr. Madre, to address us briefly on this subject.
Good morning again. In line with what you have just indicated, this forum serves as a great opportunity to review, assess, address the limitations of, and where possible, gain consensus on our policies and strategies with respect to non-traditional medications. I therefore look forward to the discussions that we are about to have and to recommendations on the way forward.
Thank you very much, Mr. Madre. May I ask for Professor Terence Simangal, Dean, Faculty of Medical Sciences, UWI, to address us briefly.
Thank you, Chairman. I think that this investigation or review is very timely, and we do need to look more seriously at the alternatives available to the people of Trinidad and Tobago and to regulate it in some way. So I think this is a very good idea. Thank you very much.
Thank you very much, Professor Simangal. Professor Jayaraman.
Thank you, Chairman. I just to concur the views of Dean Simangal, because this is a high time to open up discussion about this, because the public want to know what is exactly can be used and what can be sold outside and what can be bought. And we as researchers and attached to University of West Indies, we are doing plenty of basic research along with the medical sciences. So we have some data. So this, opening up this will give a clear idea about the situation here. And also we have plenty of natural resources, plants here. And that will, once we start exploring them, it will provide some import substitution and also open up some industries. So there is a lot of potential, and this is a very timely discussion. And I appreciate this.
Thank you very much, Professor Jayaraman. And now may I ask Mr. Andrew Rahman, the President of the Pharmaceutical Board, to address us briefly.
Yes, so we in our profession also appreciate the work that will be put into this committee. While there are some benefits to these products, at this point in Trinidad, I am of the opinion, and the profession is of the opinion, that it is doing more harm than good at this point because of the absence of regulation. So we really need some form of regulation because of the harm is being done at this point.
Okay. Thank you very much, Mr. Rahman. As chair, I will pose a couple of early questions, and then I will open the discussion to colleagues. And I want to address, first of all, questions to both Professor Simangal and Professor Jayaraman with respect to the first Professor Simangal and then followed by Professor Jayaraman. The question is, could you briefly indicate what have been your definitive findings so far as published in the established journals with respect to the research that you and your colleagues have done at the Faculty of Medical Sciences? And the second follow-up question is, how did you go about selecting the items for review and research that resulted in these published papers? So, Professor Simangal. Yes.
Thank you, Chairman. I think I could classify the types of work being done into three areas. One is descriptive pharmacology, in which we are looking at what is actually in use in the population. The other one is basic science research, in which they are looking at the role of the chemicals and isolating some of them from plants, in some cases marine organisms. And the third one is experiments on using animal models. And I've got experts in the three areas here with me, so I'll ask, and with regard to selection, I think the people who do it are perhaps the best people to answer that, so I'll call on Professor Clement, and then on Dr. Maraj from the pharmacy school to explain. Professor
All right, thank you, Mr. Chair and members. My area mostly is in the survey of medicinal plant use in Trinidad, and I've done quite a number of studies in different conditions such as asthma, cancer, hypertension, high blood pressure, diabetes. We also did a national survey a few years ago where we looked at the use of plants in about 50 rural villages, and we were able to describe what individuals use on an individual basis. And from that, we were able to list a number of plants that were commonly used, and also to determine their perception of the effectiveness of these remedies. So from that perspective, we were able to capture a lot of information, a lot of knowledge, folkloric knowledge about herbal use and how people perceive it. We also did a study with doctors and their knowledge and perception of herbs. And what we found was that they accepted it, but it was not the local herbs, but it was more the imported herbs. And the reason for that was that there was more evidence for those plants such as, say, St. John's wort or echinacea or saw palmetto, as opposed to local herbs such as bacano and plants like that we find locally. So there is a gap, as we saw in the medical profession, between the acceptance and their knowledge about local herbs. We did a survey, as I said recently, and people in the villages, they found many plants, about 100 of them, that they use for conditions such as fever, things like cooling, such things like diarrhea and vomiting. But that information is by survey and the perception that people have of these herbs. We don't have information basically on whether they really work using trials, which is normally the gold standard for determining whether something works or not. So for the local herb, we don't have that information, and therefore people use it because of tradition and folklore, not so much because of the evidence.
Right. I'm looking at the economics of it now, Professor Clement. Have you been able to identify in Trinidad and Tobago maybe a couple of these herbs with the desired outcomes from your research, which if we can commercialize, can result in something that could be a valuable over-the-counter medication sold internationally? You mentioned St. John's wort. I know that there are other things that are over-the-counter, but could you identify from your research of the 100 plants that you mentioned, maybe one or two of them in which there is such potential that with further research we may end up with a very good product for international marketability?
I will just answer shortly, but I want to refer to Dr. Sandeep Maharaj for this, but I can mention that things like aloe vera is something that's very commonly used, but it's something that's used all over the world. So I don't think that we have any unique benefit from having something like aloe vera because it's already used all over.
Right.
So I refer to Dr. Maharaj to answer that.
Very well. Dr. Maharaj?
Good morning, Chairman.
Could you please activate the microphone? Yeah.
Yes, good morning, Chair Committee. I'm sorry,
Yeah.
to repeat myself. Whenever we try to isolate the life of the study, one of the very first things to look at is the potential of so it's not only we look at the chemical efficacy and potency of the topic, but we also try to isolate the species to one of the challenges that we have recognized and the research that we have done is that scalability and land mass cultivate and actually get these herbs into a potent form to be used in a very scientific method for treatment sometimes can be a challenge. And we have this sort of diversified research because we have 1/4 land mass and there's 2/4 erosion, and that's why we have started looking at marine content. Because we have to populate and grow because there's some water is a bit easier, and hence we are looking at the potential there of getting marine sponges and things that can grow because we recognize the challenge of scalability.
Okay, but have you been able to identify any plant or marine species of Trinidad and Tobago which offer at this stage such promise that it warrants further research because it can, scalability notwithstanding, it can result in products which can compete internationally with respect to over-the-counter I'm talking about?
Now, definitely, Chairman, what has you guys and it's in the paper there that we have submitted to the committee, explain it's 87% effective, while traditional treatment such as the antibiotics that are currently being used is about 83% effective. So I mean, there is potential. It's for us to move it forward to the next stage.
Very well. That means that there should be some collaboration perhaps with the Ministry of Agriculture if it is a plant that can be cultivated. And is this information the research that you do and that's published, is it available to the wider population or is it purely kept within the medical community? Right.
It's available to the entire
Very well. Thank you very much.
Chairman, a follow-up?
Yeah.
Chairman,
yes.
just a quick follow-up.
A follow-up, yes.
Between the comments from Dr. Miraj and Dr. Clements, I'm uncertain as to whether we are talking anecdotal perception or we're talking science. I just want some clarity on that, please.
So in the case of Zabapique, Nerolina lobata, right? First, the product was identified by our good friends at the herbarium to verify that that is the genus, the species that we're using. I'm giving the science behind it. We then phytochemically analyzed it, to make sure that the types of chemicals that are required for wound healing can be found in it. And then after, we did animal model studies, in this case, rats, whereby we utilized the rat model for wound healing to make sure, and we compared the traditional, which we'll consider the control. If you do nothing, if you just leave the rat there and the wound on its own, as well as if you actually utilize the product developed. And in this regard, we then check to see the proline levels in the wound, to see the length of time the length of the wound and see how well it's healing. And we also check to see the granulation through pathology. And from that, we could clearly state it was 87% effective in a 13-day period, while the traditional antibiotic that used was 83% effective, while the normal, if I just leave the wound alone, 78% was effective in the wound being healed.
Were these results published in an international journal?
Published in international
Very
journal,
well.
cited.
Peer-reviewed?
10 citations already utilized elsewhere.
Thank you very much. Ansel Antoine would like to come in.
Are you aware that Zevapique is used in a different form in Trinidad and Tobago in terms of the common cold? And was any research done in that area? I wasn't aware of it dealing with wounds, but as a cure for the common cold.
Mr. Chair and Member Ansel Antoine, if I could respond to both questions from Member West and Antoine. In terms of the level of evidence, there are different stages of evidence, and the gold standard for evidence is studies in humans. So although there are studies done in animals and in cells, that is not the ultimate evidence that we will require. And that's the difference between herbs in Europe and North America as opposed to herbs in the Caribbean. In that, in those places, they have a lot of studies, a lot of evidence done in work in humans. So they conduct clinical trials, and they're able to show from these compounds or these preparations, most of them standardized, where they know what the active compound is and how much of that active compound is in the preparation in humans. They're able to have a definitive statement to say, this extract works for this condition. In the Caribbean, we don't have that sort of evidence. So even though we have evidence from animal studies, we cannot always extrapolate that evidence into humans because it doesn't always work that way. Also, there's also issues of safety. In an animal, we're not able to determine whether, if you put it in a human, if it's also safe in the same concentration or the same dose. Answering the question from Member Antoine, the plants are used for many different conditions. So it might be used for wound healing, it might be used for cough and cold, it might be used for fever. And we have found that in our survey that we did a few years ago, that we have the same plant being used for multiple conditions. And therefore we have to be careful what we say, what the plant is being used for. Even in Trinidad, the plant may be used for one condition, but in Barbados or Guadeloupe or Martinique, it may be used for something totally different. So therefore we have to be careful of that, and also be careful of the name, because there's a scientific name and there's a common name. So in Trinidad, we might have a common name, which is not found in another part of the world, not found in Barbados or Jamaica. But we have to be careful of what we use in terms when we publish the scientific name, because that name is the name that is common all over. But the common name might be different in different places.
One follow-up from the chair before I move to Professor Jayaraman, because I do want to get Professor Jayaraman into the... Yes, and the PS will come in. But have any researcher, to your knowledge, at the UWI or anywhere in Trinidad and Tobago been approached by a major pharmaceutical company, Eli Lilly, Novartis, Merck, Pfizer, with respect to some of the research you have done so that they could assist with the clinical trials and testing? Have we reached that stage? Okay. Right.
Ms. Como might be able.
Right. Okay, Ms. Como?
Sorry, I thought it was on. Sorry. Yeah. I have been approached by pharmaceuticals abroad to actually collect material from Trinidad for them to send to their pharmaceutical labs for testing.
I'm concerned about, looking at the interests of Trinidad and Tobago, is that I would like to have the research patented in Trinidad and Tobago, and that we have the intellectual property that is associated with native plants. And I think that's another area of policy, because I do not wish for us to spend huge sums on research only to be utilized by entities abroad. We in Trinidad and Tobago should be able, in my mind, to market the promising products if, in fact, we can get to the stage of commercial applicability. But we will deal with that as the hearings proceeded. It is good, Ms. Como, to know that the foreign firms, I'd imagine they are large pharma companies, are interested and looking at the kinds of the intellectual property we have with respect to plants in the herbarium in Trinidad and Tobago. So that that will inform the deliberations of the committee. We have heard of in the past of too much of our intellectual property going into the common domain, and we have not been able to keep it for ourselves. So that I will be liaising with the university on how we may patent and secure our intellectual property with some of the research that we are doing. But Professor Jayaram, we are not yet open, we are just preliminary. Professor Jayaraman, you are also doing research. Could you indicate what have been the big successes that you have been able to secure, which resulted in acceptance from the international community with respect to the matter at hand?
Thank you, Mr. Chairman. We belong to basic sciences, the science and technology, Faculty of Science and Technology. We do basic research, and we also support our colleagues in medical sciences because they are the front runners in this. Okay, so we provide all the support. So our focus is mainly on identification of the plants of potential therapeutic value and also the seaweeds. We are also working on marine sponges lately. These are not just to directly bring out a product which can be straight away recommended for therapy, but understand the mechanism, what is in there, and what is the activity, how it works. So that is our area of specialization. Because just to simply suggesting something as a remedy is something happening for years, but we do not know exactly the scientific basis, the scientific mechanism. So our aim is to provide scientific evidence to whatever you recommend. So with the scientific evidence, it becomes a real product at this point of time in the world, because anything without a scientific evidence or a basis has a very weak selling point. Okay, so what we have been doing is about identification of the plants and the marine species, that also includes marine bacteria. We have plenty of candidates and many things we haven't published. I'm coming to the point how to protect our resources, and we are very careful about it. And characterization of the metabolites, the secondary metabolites, and the molecules. And my colleague, Dr. Nigel Jalsa, is one of the experts. There are a few more people. I did not bring all of them. So he is here, so he can talk about it. And also, understanding the in vitro and in vivo activity, that is in the lab, to the test specimens, for example, a bacterium, a pathogenic bacterium, or to the cell lines, what is the activity, whether it is toxic or non-toxic, whether it has a therapeutic value. So that has to be studied. So these basic studies we do. And we are also trying to express certain therapeutic molecules in the plants. So whatever that is synthesized outside by chemical derivatization or by synthetic chemistry, we can also do the same thing in the plants. If you ask the plant to do it by minor modification, so we are also doing that. So that will have a tremendous potential in making vaccines as well as other therapeutic molecules. And we are also doing some work on probiotics. We have identified several probiotic bacteria which have some kind of association with the existing living systems. So they may be found inside our body and also outside. Of course, we are eating them almost every day if we are eating vegetables. So
may I interject?
Yes.
The issue is the research you are doing is simply voluminous. Out of that research, what definitively have you been able to find at this time which can be of interest to policymakers to say that the research is so fundamental that we need to look at it to see to what extent it's going to improve the health status of Trinidad and Tobago and may even result in a merchantable product?
Yes, some of them have reached to the stage of where it can be given a kind of recommendation. But remember, we are not supposed to do directly clinical trials.
Right.
If we are supposed to do it, has to happen only through our colleagues in the Faculty of Medical Sciences. But we do some small animal model studies. And a couple of our members have also done some kind of screening of the local fruits, the wild fruits as well as the local fruits, against the diabetes as well as some other non-communicable diseases.
And Professor, is it that the research you have done so far has received acceptance from your peers internationally, that they recognize that it has followed the methodology and the procedure, and that what you have found therefore can pass scientific muster?
Yes. Part of them have been published. I do not have them right now in my hand, but they have been published.
Right.
They have been discussed in peer-reviewed conferences, and some of them are published as student reports. And a chunk of the stuff which we do not want to publish, as Chair pointed out, because the moment we found certain marine algae which have some potentially therapeutic molecules, it just the word went out, and then I already got a call from people outside. What is that algae, where it is available, can I have a sample? The same thing happened with some of our bacteria which I've identified. When we put a preliminary report, we already got calls even from some of the companies.
Thank you very much.
So,
you have pointed us.
We did not reveal.
Right.
So we are working through our Office of Knowledge Transfer and Research.
Excellent. I need to stop, but I think you are raising a critical point with respect to what we have in Trinidad and Tobago as intellectual property in the herbarium, what we are developing from your research. I think we would need to look carefully at how, as a policy matter, we keep that so that having expended resources on it, we can benefit as a country from the products which may develop. But P.S. Madre wanted to make a point. Yeah, but P.S. Madre, you wanted to make a point?
Well, I think that the point I was going to make has been superseded by the contributions of others, but it was really along the lines of the importance of making sure that the scientific research supports a view, and to note that what may be indicated, what a therapeutic indicator at the first level of the research may not be supported by the phase 2 of the trial or the phase 3 of the trial. So I think it's important that be understood by the layperson out there.
Yeah, thank you very much, Mr. Madre. And now we have the floor with deep interest. So let me prioritize.
I'll give it to the lady.
No. I will allow the vice chairman. So the order is vice chairman, Senator Amin. Any interest? And then Senator West. So vice chairman, Senator.
I'll be guided by the chair.
Yeah.
Now what we want to discuss today is basically non-traditional medication, right? To educate me and also to educate the listening public. What are considered non-traditional medication? Any member of the panel?
That is an extremely open question, actually. When you put it like that, it's very difficult to define. But when you think, if you look at the training in medical school and how we train people on the use of drugs, on medical interventions for which we say that there is evidence, these treatments and these practices are controlled by the medical council. Anything, or the medical board, anything outside of that will be considered non-traditional or complementary.
So it's clear to say that once the medical doctor has not prescribed it, it's non-traditional. Fair enough? Is that fair enough to say?
That's a reasonable starting point.
Because
some doctors are also, as Professor Clement said, also use a non-traditional approach.
So the individual that is saying that he has the cure for AIDS, that is not a medical practitioner, that is selling these various items at the side of the road, at the street corner, at his location, is he or she operating legally or illegally in Trinidad and Tobago? The person who is saying, listen, I have the cure for AIDS, I have the cure for herpes, I have the cure for cancer, as the case may be. How do we consider those individuals?
I could only give an opinion on that because I'm not a legal expert, but the medical board controls practice only amongst those who are registered with the board. Also, according to the Medical Board Act, if someone holds him or herself out to be a doctor, a medical doctor, then they are contravening the law and can be prosecuted. But if somebody stands at the corner of the road and says, hey, I have the cure for HIV, and they didn't hold themselves out to be a doctor, the medical board, as far as I understand it, and as I said, I'm not a legal expert, does not have a jurisdiction there.
Mr. Pierce, you care to shed any light there?
I'll say that there, actually, I'll pass it over to the Chief Medical Officer.
Dr. Amon.
Yes, okay. Dr. Amon. Chairman and members, yes, in terms of the answer to the question, it is along the same lines of Professor Simongal. In terms of the Medical Board Act, does prescribe for persons to be duly registered with the Medical Board of Trinidad and Tobago after passing through an approved curriculum and approved tertiary institution to be so recognized. So the short answer to the question is that I do concur with Professor Simongal in terms of in those instances as you described, once somebody makes a claim, which is what it is, they make a claim that a product has certain therapeutic ability, but they are not a registered medical practitioner legally, it is difficult within the legal framework of this country to take action in the current legal framework.
Right. But Mr.
Thank
Chairman,
you very much. Is that a one burning question?
Yes, it's very
one burning. All right.
Right. I just want to quote, in May 12, 2013, the Guardian newspaper published a report entitled Headache for Herbalists. That's the headline. The report claimed that the legal department of the Ministry of Health wrote the Director of Public Prosecution, and well, the name is quoted, to take action against herbal practitioners who publicly advertise curing body illnesses. And to go on, was any action taken back then? I don't know, it's 2013. Mr. Pierce, was any action taken back then by the ministry? What was the basis on which the ministry decided to proceed with litigation at that time and so on? Any light can be shed on that information that quoted in the Guardian?
We will have to respond subsequently.
If once you have done the research, you can respond in writing, yes. May I ask, thank you very much, MP. May I ask Senator Amin to come in at this point?
Mr. Chairman, the question from the Vice Chairman falls into what I want to come to. In the absence of regulations, have you had any consultations or reached to the point to make any recommendations for legislation to govern these herbal or alternative medicine practitioners?
I'll first make a point that in other jurisdictions, non-traditional medication, herbal substances are defined as substances that support rather than cure, right? So that is an issue in our jurisdiction as to how we will treat with it. Yes, there are no regulations that govern non-traditional medications at this point, but such regulations are under review. There were draft regulations that had been done many years ago. In our most recent discussions, that has emerged, but we have not yet followed up on the the reasons why they were put on hold. We have checked with the Chief Parliamentary Counsel's office, and we have been informed that they were put on hold there. We do know that we are currently reviewing those drafts.
Okay.
Perhaps the Chief Medical Officer or our head of chemistry, food and drugs.
Could you, once you have reviewed, would you be in a position to supply the committee with the outcome of the review? Yeah.
Most certainly.
Very well. But there is another issue, a follow-up from Senator Amin before I proceed to Senator West, and that is something such as acupuncture. It is used internationally. Do you know if acupuncture practitioners are registered in Trinidad, whether they must be screened by the Ministry of Health to determine that they say they can do what they can do, or can anyone simply claim that he has expertise in this field and set up a practice on that?
Thank you very much for the question. The short answer is that in the specific example of acupuncture, the answer is no. In terms of the registration of persons who are actually practicing medicine or fields allied to medicine, we do have the professional bodies like the Medical Board and Nursing Council. We also have Council for Professions related to medicine. That's also within the ambit of law and under oversight of the Ministry of Health. So that includes like psychiatrists and social workers, persons who you would typically see in the traditional medicine. In terms of the other types of non-traditional medicine therapies, it is not regulated at this point in time by way of registering members. And part of it relates to the prior discussion that was had in terms of the level of scientific evidence.
So the answer is they are not regulated, and there is no register of people who practice acupuncture, as we have, say, a register of medical doctors. And if someone says he is a specialist in his field and someone chooses this form of therapy, he has no assurance that the practitioner is competent to actually administer the practice. That's so in Trinidad and Tobago. That's so? Right. Okay. The second is with respect to, I noticed that there is also Ayurvedic medicine. Is it that we have practitioners who can practice that form of healing without being registered anywhere, and they can simply claim they have these skills and they may or may not? Are they also screened by anyone, or is this caveat emptor, the public will have to undertake its own necessary inquiries?
Chairman, the short answer to your question is yes, they are also not currently registered in terms of the Ayurvedic medicine. In terms of the Medical Board Act and the Medical Council, they do have their entry requirements for matriculation to be registered, and within recent times I've also have a specialist register which describes the postgraduate courses and qualifications in order to be registered as a specialist in the medical field. But these other fields at the current time, no, there's no regulations or no registration body for sale.
Okay, thank you very much. So we may need to look at the Medical Board Act, but
on this
is this a follow-up? Make sure it's a follow-up on this particular point.
It is. Now, going back to the president of the Pharmacy Board, Mr. Rahim, right? You mentioned in your opening statement with regards to absence of regulations, more harm may be done than good. I think it's probably a good time, Mr. Chairman, in terms of the regulations, in terms of these individuals who are operating, not above board or whether under board, to hear what's the opinion and to expound on your earlier statement with regards to regulations and so, Mr. Chairman.
Yeah, yes, so briefly, because I do want to engage Mr. Rahman at some other point, but Mr. Rahman, you can come in at this point.
Well, essentially, it might well serve a good purpose to give one or two examples of instances where people have been, I'm giving you a reason why I said it does more harm than good at this point. There are many people who, as was said before, that the products are really for the support or to assist with certain things. And there are many people who have been diagnosed with serious ailments, prostate cancer and so on, that continue to use the items that have been said to support it. It is really an attempt to prevent, but these things have such a huge genetic link that these items are not sufficient to assist with either preventing that genetic outcome, and they cannot assist with treatment. So we have a large proportion of the population utilizing these medications under the guise that it is herbal and purer and not interfered with by science, when they are actually diagnosed with problems, or they are experiencing the problems, the symptoms of particular ailments, glaucoma and so on, and continuing to use the herbal medication while going blind, while leaving their prostate cancer to degenerate, because they continue to use herbal preparations. So in the absence of education and in the absence of regulation, it does not assist the plight of many persons. And the cost of medical care is triple or quadruple in those instances.
So basically, persons are using the support medications or items meant simply to support as mainline treatment. And that would result in an ineffective health outcome.
Yes.
Very well. Thank you very much. Senator West, you can come in now. Yes.
Thank you, Chair. I would like to go back to the original discussion involving the research into the various products in Trinidad and Tobago and how we move forward with where we are in terms of those products. Is there a plan, is there potential for us to move through the stages to commercializing these products and making them more widely available?
I'm not a legal expert, Senator, but to the extent of my knowledge, I can comment on this. Those days of patenting a plant or animal or even a gene are gone. So we no longer can patent a plant, but you can patent a product derived from the plant. So the straight answer here is you can, anybody can make a formulation out of one plant or more than one plants and identify what are the ingredients present in there and what is the therapeutic value, and that can be patented as a product. Okay, so that is the only way how it can work. But unfortunately, in many of these plant-derived products, it is not a single molecule which has the therapeutic value or effect. It is a consortium of things. Many things come together. It is a synergistic activity. So we can study the profile of it, but at the end of the day, what is going to act upon is a group of stuff together. Okay? So in this case, commercialization is fairly easier than going through the route of synthesizing and then derivatizing the compound and testing. It's a very long route. But this is pretty easy. This has been done by many people, and we can take examples from other countries. For instance, Jamaica. So Jamaica has commercialized many of their products derived from plants, and they are selling it, and these are all registered and even might be patented. And these are even exported outside, primarily to North America. So there is a big window of opportunity here. And again, we can do this scientifically. It's not just like selling a bush medicine, where you just get it and then make a powder, put it into a capsule, and then sell it. But let us do it scientifically, where we verify, we provide the evidence, yes, this works. And Faculty of Medical Sciences, they do have the facility, they have experts, and we also have the expertise to do some basic studies and prove the effect and say this works. And then that has a real value to be registered as a product. But for the question of whether it can be straight away patented, to my knowledge, it cannot happen here, nowadays. Yeah.
Yes, the sense I get, though, is that we have progressed only so far in terms of our research, and we are up against the wall that is created by the clinical study process. So how do we get past that? How do we engage in that so that these products can not only be created and formalized, but can be internationally accepted?
Professor Klein. All right, Chair and Senator West. I believe that our issue in the Caribbean is our size and funding and money. And research in humans is a big cost. So right now our research is restricted to the lab in animals, but as soon as you start talking about trials in humans, that's where the cost is. Not only with human, but also you have to have products that are standardized. So you must know in your product what is the active compound, how much of that active compound is in that, and you need to standardize that. That's a cost to the pharmaceutics department. They have to prepare compounds or preparations. They have to prepare also what we call placebos that look and taste and smell just like what we are giving patients. All of that is a lot of detail. You need resources in terms of personnel, in terms of expertise. You need people to make those preparations. You need people to give patients those preparations. You need to follow people up over months, over years. You need to test people for safety. You need to test them for outcome that you're looking for. So all of that is a huge cost. And with our small economy, I don't think that we sometimes think that that is so important, to focus on research and development. And even at that point, when you have results from human studies, you need to convert that results into something that is commercial. So you just don't jump from having results from a study and just start selling. You need to produce your preparation in some form that you're able to sell. And the reason why Europe and North America and Australia has a multi-billion-dollar industry, because they have been able to supply the evidence that these things work for the indication. So like St. John's wort for depression, echinacea, sulfamethyl for prostate enlargement. They have invested a lot of money in providing the evidence for that. And they have used that evidence to commercialize and to bring that result into products that they could sell. And they've been able to do that successfully with having an industry that's worth billions of US dollars. And we
very much. Professor, I need to interject because you have raised a very valuable point in response to Senator West's position, in that we are relatively small in size in relation to the jurisdictions in Europe and North America. Now, from my research, I have been able to identify 3 types of pharma. The type produced by Pfizer, Merck, Novartis, Eli Lilly, chemicals. Then you have another type produced by Regeneron and Celgene, which is modifying the genes and working on the biopharm space. There's a third type, plant-based, where you can produce the St. John's wort, echinacea, etc. In your opinion, given the small size, if you were told that we are resource constrained, where do you think we have the greatest potential in Trinidad and Tobago? If we were to direct our energies for us to be able to create a space in the broad spectrum of pharma that you know it. Is it plant, is it cells, is it chemicals? Where do you think we should go?
Chair, there are a number of ways that we can go. One is that we can probably form partnership with people outside and keep the intellectual property and benefit from that intellectual property. So I think what we should really do, we should probably focus on a few plants that have potential, and we could provide the preliminary work, and we can have a partnership with those people.
So you are thinking that maybe we should not go the Celgene, Regeneron, or Eli Pfizer, Merck, Novartis, but maybe focus on what we have occurring as plants and use that as our basis for competitive advantage.
Yes.
There is a response from the back. We would like to bring him in, yes. Your name again, sir?
Nigel Jalsa.
Right.
Good day, Chair and members. When we speak about non-traditional medicine, it is often with the narrative that it is, to a certain extent, folkloric, right? And that tends to inform what we prescribe it for or what the anecdote follows. But something that is missing is that almost historically, all the medicines that are produced by pharmaceutical companies, right? Virtually all of them have their origin in non-traditional medicine. So if I were to give an example, the willow bark or the bark of the willow tree for many centuries was known for analgesic properties, so pain-reducing, fever-reducing properties. By extracting the willow bark, the component of the willow bark, hydrolyzing it and then acetylating it, it gave a product that I am certain everybody is familiar with. That is aspirin, right? Yeah. So the non-traditional medicine actually has traditionally informed all the major companies, Eli Lilly, Pfizer, Novartis, etc. It is within the recent decade that they have focused less on natural products and more on something called diversity-oriented synthesis to generate a large library of compounds. And the reason they've done this, Dr. Maharaj alluded to it, is that the issue with natural products is that what the problem is that you have limited space, you have limited quantities. For example, one of the most powerful anti-cancer drugs on the market, which is Taxol or paclitaxel, to get a single dose would require harvesting of the entire tree of the Pacific yew. So that is why then the synthesis part or the chemistry part of it becomes important, because when we look at non-traditional medicine. So we have an idea that this plant extract or this concoction has a particular effect. What the pharmaceutical companies do is that they now analyze and isolate the components of that mixture and then perform derivatizations on that compound for two effects: to improve efficacy, right, as well as to reduce toxicity. So to separate the non-traditional medicine, the bush-based medicine, to use local parlance, from the pharmaceutical endeavors, in my opinion, is not a wise endeavor. I will give an example from within my own research. Many of you hear me be familiar with ackee, right? As in terms of the Jamaican national dish of ackee and saltfish. What the issue with ackee is that when you eat ackee that is unripe, there's an active component in there, something called a non-proteinogenic amino acid that is toxic. It has a lot of toxicity associated with it, and that is what causes the adverse effects if you eat the unripe fruit. One of the things that we're looking at in my lab is to take that hypoglycine and to perform structure-function reactions on it to reduce its toxicity, but see what biological activity it has. So I would suggest that our focal point shouldn't only be on the non-traditional or plant-based medicine. Certainly that is the starting point, because that is the starting point of every pharmaceutical company throughout the world. But in addition to which too, where we add value, because where we increase the value and make it to the point where we could make a drug, right, which of course is a distance pipeline, is that we identify the active compounds and then we serve to make those compounds increase activity and lower toxicity.
Thank you very much, and we will be following up on that. But we do have MP Antoine, and we do have MP Glenda Jennings-Smith, and I will come back to my colleague Vice Chairman on this round. Yeah. So MP Antoine.
My question is to the Ministry of Health. Which types of complementary and alternate forms of treatment is the Ministry willing to endorse on the one hand? And what types of complementary alternative medicine is the Ministry unwilling to endorse? So is the Ministry willing to draw a line between what types of medicine they would approve and not approve for use among the population?
Okay, at present, if it is we look at the Food Act and Regulation, it gives a definition of what a drug is. And it clearly indicates in terms of what a drug is and what the component of a drug is. And within the regulation also, you have the Drug Advisory Committee that has the responsibility to advise the minister regarding drugs and recommend to the minister any drug to be registered for sale in Trinidad and Tobago. So currently, in terms of the definition, it would cover most of what we consider to be traditional and non-traditional, also based on the broad spectrum and the broad definition of a drug. So based on that definition, and the work of the Drug Advisory Committee to advise the minister regarding the registration or the approval of a drug to enter into the market and to be sold and distributed within the market. And that gives us the remit and the scope to register those drugs that falls under the definition as per the regulation. Not sure what that answer or...
All right. Basically, the question was a straight one. Is it that the Ministry of Health has endorsed certain products, and is it that it has not endorsed others, and that it has endorsed certain products because of the reports maybe received by medical doctors that they tend to help with patient care?
Okay, so yes, within the Drug Advisory Committee, we would have recommended certain herbal supplements to the minister to be approved for sale in Trinidad and Tobago.
Okay, and
And because I realize you have a member of the herbal subcommittee here. What is the role of the herbal subcommittee from the Ministry of Health?
Right, so if you permit me, I could pass it on to Dr. LeBlanc to answer that.
Very well. Dr. LeBlanc, the role of the herbal subcommittee, I was not aware that there was a herbal subcommittee, so we are learning a great deal from the hearing. What does the herbal subcommittee do?
Good morning, Chairman and members. The Herbal Subcommittee is looking to give guidance to the Drug Advisory Board in terms of how we look at the regulation of the herbal supplements that are in the country, both local and international. We are trying to produce a policy which will allow for better regulation because, as everybody agrees, we do have tradition. We have our tradition and we know our bush medicine. And we also have traditional Chinese medicine, which has been around for many years. And this has a lot of scientific base. But we have to find a policy to regulate the entrance of these products into Trinidad and Tobago to safeguard and protect the population to the best of our ability. So the Herbal Subcommittee will then have assessors. We will assess the herbal products that are being brought into the country to advise if they are safe based on our herbal knowledge, our medical knowledge, to the best of our herbal and medical knowledge and clinical and evidence-based medicine.
Very well. Okay. There is a follow-up before you continue with your follow-up, MP, because you're raising an important point. You are saying that registered medical practitioners are in receipt of information which will assist them to recommend traditional as well as non-traditional medications. Take, for example, 2 items, black cohosh, CoQ10, and orange peel tea. These can be considered to be non-traditional. How would the medical practitioner come to gain the information that CoQ10 should be recommended under certain conditions, black cohosh and orange peel tea? And I know for a fact that one medical doctor, to my knowledge, I shall not mention, eminent specialist, who has recommended these three. So how did he come to that knowledge? And all of them appear to have worked, right? How did he get? Is it from your department?
The Herbal Subcommittee is new, but it would be from our department. But we must understand the difference between a supplement and a herbal plant or herbal medicine, because CoQ10 is a supplement.
Yeah.
Orange peel tea and black cohosh are herbs, medicinal plants. For example, I studied medicine in Cuba, and in our curriculum, it was introduced, our natural and traditional medicine was introduced into our curriculum. There are schools of traditional plant medicine and traditional medicine in terms of herbal medicine. So we look at that, and doctors can learn that, and we can be complementary medical practitioners. And then you have CoQ10 and omega-369, omega XL. All these are supplements. And what they are really is that we have seen in the medical profession and in medical science, we've seen that, for example, omega-3, which is your big one, is anti-inflammatory and helps with our different cholesterol issues and our arterial inflammatory issues. And therefore, they extracted that. But those are supplements. So that's why the doctor that you know can recommend that. And where black cohosh is concerned, and sorry to cut you, an orange peel tea, again, it's tradition, but also phytochemistry has shown that black cohosh, for example, has the phytoestrogens, and it's been used traditionally for what it's been used for.
Okay, so my question is it the specialist medical practitioner who recommended CoQ10 because of the pains associated with a statin drug for cholesterol, was using folk medication? And the thing is, it worked. Without the CoQ10, the statin drug was terrible, right? Now, where did he get this information? Or is it that he is just thinking that maybe other patients have recommended? I would like to know where are they, because established medical practitioners are recommended the things when there are side effects of the chemicals which are used for main ailment. As Mr. Rahman said, there are main interventions which will cure, but they do have side effects, and the medical practitioner who is interested in the welfare of his patient looks at these other areas. I simply would like to know, is there a body of knowledge that he or she can draw upon, or is he just using folk medicines to help him to cure his patient or make his patient better? Where does he get the info?
Yeah, there is a large body of information now, relatively, on CoQ10. Most medical practitioners get the latest information on a publicly available website. It's called pubmed.gov.
Yes.
So you can look up CoQ10 there and you'll see all the research.
I know we have two colleagues, and there's a follow-up from MP Antoine. But with respect to all of these supplements, they are not sold under prescription. Is it that the pharmacist is expected to have knowledge of the potential effects of all of these supplements so he can advise an over-the-counter buyer on what the potential effect of these might be? Is it part of your training, or is it that you, in your profession, you come together and you say, well, this particular type of tea will put you to sleep?
There is a subcomponent of a course at the University of the West Indies School of Pharmacy. So there is a course on complementary medicine. But that said, in the practice, we do not that much recommend. We do get a lot of inquiries, and we use the opportunity to educate persons on the fact that once you must still go for your diagnostic information. And once you are diagnosed, there ended usually the usefulness of the medication. But we do get significant resistance from people who, we have to remember that we have to look at the benefits of the medication outweighing the side effects. So there are times that you might have a side effect of a cough of a particular medication, but the side effect of not using it is a stroke. It's the entire loss of use of your left side. So you have to weigh up. So I think the side effects have been touted as a reason not to use the items, which will be proven to help, and which in many cases are on the literature. The literature might state 50 side effects, and a person might experience none or one. And the one might be so minor when compared with not using it and getting a stroke or a heart attack and so on.
Direct question. A woman comes into you in your pharmacy and she says her friend uses black cohosh and it works for her. Can you advise me on what the effects of this would be for what I'm experiencing at this time? Will you be able, do you have the expertise, or are you expected to have the expertise to advise that buyer that black cohosh can have these possible effects if you use it?
Well, again, the information is available, but we lean on the side of pure science in that regard. And if the trials are not, I mean, there may be pharmacists who may have a dabble a lot or somewhat in the practice of that type of medicine. But on average, we deal with the scientific part, and the scientific part has not been as forthcoming because of the issues with funding and human testing and so on.
So basically, Mr. Rahman, of the dozens and dozens of supplements I see out there, you're saying that the pharmacist, if I were to ask the pharmacist, what is this product, lutein, I think called, that is used for, he would be reluctant to tell me?
No, he would give the information that is available.
Right, very well.
Yes.
Thank you very much. And we have one burning intervention from the doctor in the back before we get back to a follow-up from Ansel Antoine MP and then MP Jennings-Smith, who has to come in after MP Antoine.
Chair, I have to place this position because it's the School of Pharmacy and we put out students there. They are definitely trained in a 3-credit course in alternative and complementary medicine. And we should know that herbal medicine has actually evolved over time. And there's a pharmacopoeia for herbal medicine, which tells you the dose, the active ingredient, the indication, the side effect profile, and how it should be taken. So that is there, and they're made aware of that. There's a whole book that they're all made familiar with, the pharmacopoeia, which is recognized by the US FDA. So it's not that it's magic, no longer. The orange peel tea, I may not know. But the other areas, it's not magic. They're very much well documented. So anecdotally, I might be able to help you there, but otherwise. But just to let you know that, yes, it's definitely well documented. There's a body of literature someone can turn to that gives very much like a normal medication all of the information that's required, and the students are very much made aware of this.
So that the pharmacists now are trained to really administer the kind of information that for the products that are sold over the counter.
And they are trained to know where to get that information.
Very well. And for information, orange peel tea was prescribed after childbirth to get rid of gas by one of the leading obstetrician gynecologists in Trinidad and Tobago. He did not use Gas X. He's recommended orange peel tea. And he is one of your established peers. All right. And I was told by the Deputy Speaker it works very well. Personal. All right. MP Antoine.
Yes, I follow because I cannot let go of the herbal issues at present. And I go back to Zebra Peak. I have a Zebra Peak soaking in vermouth for the last few years, and I swear by it. Right? In terms of the herbalists and it goes back to the question about the Ministry of Health, what you endorse and what you don't endorse. What kind of research is going into local remedies, orange peel tea, Zebra Peak as the case may be, in terms of being used among the population, and is the Ministry of Health endorsing or not endorsing some of these?
Thank you very much, Member Antoine. In terms of to lead the discussion, and I would ask Mr. Khan to follow through, the process of registering all drugs, as Mr. Khan described, you have the traditional drugs, yes, but then you also have what we call conventional type drugs, which are those drugs that do not meet the scientific rigor to reach like on the level of the formulary of pharmacopoeia that we use in traditional medicine that's normally in our public sector. So these are what we call, for the late-term pharmacology drugs, right? Beyond those, you have these other types of drugs as defined in the Food and Drug Act, but as supplements, but Chemistry, Food and Drugs through the Drug Advisory Committee, and as I said, through the recently formed Herbal Subcommittee, they review these drugs, and in terms of what the Ministry of Health tends to endorse from the evidence is that those drugs that are manufactured abroad and they're imported, some of those drugs we do recognize that according to Dr. LeBlanc, they are safe for use. Now, those drugs do not enter our public sector, they more enter into the pharmacies, general private pharmacies, and over-the-counter medication. So therefore, Chemistry, Food and Drugs will endorse some of those products that are safe according to review by the assessors, and then they enter generally not into the public sector, but into the private pharmacies as supplements. And with that, I'll ask Mr. Khan to expand along those lines as a point of clarification.
Okay, thank you, Chair. So in accordance with the Chief Medical Officer, it is exactly that what he has mentioned in terms of the work of the subcommittee in terms of evaluating the particular herbal drug to determine the efficacy as well as the safety of the particular drug. And the work of the subcommittee and the expert members of the committee will evaluate based on data that is submitted from the manufacturer or the importer, as the case may be, to determine whether this drug is safe for human consumption, also the efficacy of it, whether it's going to do what it says it's going to do. In terms of the labeling requirement, also there's a requirement that the drug or the supplement doesn't state that it's a cure or prevent or mitigate. If you look at the US FDA, they would put a disclaimer on most of those products, indicating that the product has not been evaluated by the US FDA. So it removes an implicit implication that this drug can prevent, cure, or mitigate. Likewise, the work of the subcommittee also follows those same sort of principles in determining whether to recommend the drug or not recommend the drug, as the case may be. And from our database, we would say that approximately, within this year, we would have done probably 8 to 10 herbal supplements that is earmarked for recommendation to the minister via the Drug Advisory Committee.
How is the population educated about these drugs that would be approved by the minister? How do we know that these drugs are approved for use and these drugs are not approved?
Okay, so once a drug is recommended by the Drug Advisory Committee, it goes to the Minister of Health. Once the Minister of Health endorses the recommendation, it goes to CPC. And at CPC, it will be published through the Gazette notice, and also a notice of approval would be issued to the importer for that particular drug, indicating that he or she can sell the particular drug on the local market. We're in the process of creating a database, an electronic database, that would contain all of the information regarding the particular drug. At presently, it is internal, but the vision is that at some point in time, it becomes a public document where the public can actually access this particular database. But at this present time, it is not accessible to the general public.
Thank you very much, MP Jennings-Smith.
I'm concerned with regard to the protection of the public when we speak about herbals and the sale, the continuous sale of herbal medication. And to that, I want to ask you how feasible it is to implement a legal framework to regulate the sale and the use of all forms of alternative medication, Trinidad and Tobago.
Okay, thank you, Chair. Thank you, Member. We require the regulatory framework to be able to monitor and surveil these particular drugs in the market. So the regulatory framework based on the draft amendment to the Food Act and Regulation is going to give us the greater power and authority to be able to monitor and do proper pharmacovigilance and surveillance on what happens on the market. It requires a substantial degree of human resource because of the volume that we are speaking about. All right, to be able to really monitor what is going on in the external market and the pharmacies and elsewhere. So you need the human resource as well as you need the regulatory framework to give you that ability to monitor and take action that is beneficial to the public at large.
What is the status? Do you have a draft regulations for herbal medicine?
Yes, so since 1999 there were external consultation on herbal medicines, and from that committee, regulations were drafted in 2001, and presently as the PS had mentioned earlier, we have a draft 2004 at the CPC, and we have indicated that we're going to revive that particular draft document to have further consultation because that was done in 2001, 2004.
I ask you all of that, looking at the fact, looking at Section 4 of the Dangerous Drugs Act of 1991, in particular reference to cultivation of different herbal products. What type of license have you issued so far with regard to that particular regulation?
Yeah, okay. I probably could pass on that particular question to the Drug Inspectorate since they would have the legal remit under that piece of legislation as opposed to Chemistry, Food and Drugs.
Okay. Can you say if anyone applied? Yes. Okay, great. Thank you.
Thank you very much. We will come to our second round of questioning now. I know you want to raise a question, Professor, and I'm coming to the professors in the panel who are doing research. Are any of you familiar with a drug called Epidiolex, EPIDIOLEX, produced by GW Pharmaceuticals? Any pharmacist familiar with it? I know there are thousands of drugs which are produced by GW Pharmaceuticals, given FDA approval in April of this year. But what is interesting about Epidiolex is that it is a drug that is used for child epilepsy. And that particular drug, which has been approved by the FDA, is based upon the chemicals derived from the cannabis plant. So it is Epidiolex. It is now accepted. And the question I want to ask any medical practitioner here, and including the herbal subcommittee member, is if there is a child in Trinidad and Tobago who suffers from the type of seizures epileptic seizures, which this drug caters to, will you be able to prescribe this particular medication? And then I'll ask Mr. Rahman, will you be able to store it? I raise this in the following context. I know pharmacies always have a vault or a lockbox where they keep controlled substances. I was advised that cocaine was used a while back by dentists to mitigate the effects of pain. Of course, that is a banned substance. I don't know if that is still administered. But I'm looking now at the health status of Trinidad and Tobago and the range of pharmaceuticals which are now being produced, which will help. Certainly now the FDA has accepted this produced by GW Pharmaceuticals from the United Kingdom to be administered in the United States of America. I would like to get the views first of the researchers. Suppose you have researchers who would like to research variants of the various chemicals that went into Epidiolex to create different medicines. Can you conduct that type of research within Trinidad and Tobago? I'm talking about purely academic research at the university.
Thank you, Chair. The Epidiolex, the issue with medical marijuana, or the issue that is facing marijuana, is that the component in marijuana that is responsible for the adverse psychoactive effects is THC. But THC is only one of 600 plus compounds that are present in it. So we speak about THC as having the psychoactive effect, but there are a category of compounds called cannabinoids, right? CBD being one of them, and then the terpenes that are also present. These are the ones that have medicinal benefit. These are the ones that have the potential medicinal benefit, I should say. With regard to your specific question on how we do or can we do that research in Trinidad, most certainly we can do that research. That type of research, what it will involve is first having the plant, right? Having the components of the plant, whether the male plant, the female plant, extracting the components of the plant, analyzing what is present. So this would include both a structural elucidation, right? In addition to which to small benched up bioassays. When we perform that extraction and isolation, the key is to separate all those compounds. And marijuana, from that perspective, is very poorly studied. It is taking up a lot of steam within the last year in doing that type of research throughout the world, and it could almost be described as low-hanging fruit. Once you sorry.
Yes. Can you do this? Suppose you take a bottle of Epidiolex,
yes,
administered by doctors in the United States freely, or any medication administered in Canada since the year 2000, so they are 18 years ahead of us. Can you conduct the type of research that is necessary to produce a marketable product similar to the type of research you are doing on the product that was mentioned earlier for healing wounds?
Absolutely.
Yes.
Yes, we can do that research. We have the techniques to isolate it, and we have the techniques to characterize it.
Yes. Professor Clement, yes.
Chair, I think we also have to remember that for FDA approval, they have to have the clinical evidence. They must have studies in humans, different phases, phase 1, phase 2, phase 3, and that takes a period. For FDA to approve a drug or any treatment, they must have the evidence. Even though we could isolate a compound and say what the compound is, we have to carry it through that process. And I'm afraid to say that right at present, we don't have the capacity to do that in Trinidad now because of the cost, because of the resources that we will need, the human resources, right, and the infrastructure that we will need to do something like that. We will be able to do up to the point of having a compound, but after that, there's the possibility
All right.
of not.
So are you saying that we have already lost the opportunity to other countries which have been able to market the pharmaceuticals arising from the cannabis plant? Or is it that there are opportunities in Trinidad that if we were to start now using and I'd want to bring in Ms. Como in with respect to whatever varieties we have. Dr. Como, do you have the various types of cannabis, at least in some plant form at the herbarium that is grown in Trinidad and Tobago?
Be careful,
No, this is because it's a plant. Can you have it? Can you have it?
Absolutely.
Mr. Chairman, I have specimens of cannabis in the herbarium, which we collected from plots grown outside of, illegally. When we came in contact with it in the forest, we did make a sample and put the collection.
It is not illegal for researchers in Trinidad and Tobago to collect samples as they are doing with Shining Bush and so on, and to conduct the research?
That was one of the issues or concerns I had with respect to the collection of, the legal collection of it. Because remember, when we pinched it from that site, it was illegally grown. It was a farmer illegally growing it in the middle of the forest. So therefore, legally, we cannot. I have been approached by, and I wouldn't say who, certain governments to actually assist them with collecting marijuana plants from different parts of Trinidad so they can test the various components of the plant, because to see what environmental impact had on it. But I did not accept that because the plant is illegal in Trinidad. But as a reference national collection, we have specimens in it. Any kind of research that must be done with plants in Trinidad and Tobago, scientific rigor requires that you must deposit a voucher specimen in the national collection. And Professor Clement and I, when we did the work together on the survey of the 50 rural communities, I was involved with that research, which we published. All those specimens collected from those communities, we have them deposited in the collection, right?
Thank you. Professor Simangal, from your research and given your expertise, do you think there is promise here for Trinidad and Tobago as it expands, as Professor Clement indicated, that maybe we should be looking at the herbs in Trinidad and Tobago as the launching pad for any pharma industry we may develop? Do you think there is potential in Trinidad and Tobago, given the type of cannabis here, for us to conduct the necessary research first, before we go to clinical trials, to conduct the research at the University of the West Indies so that we could identify the types of compounds that Professor Jayarama has identified? Do you think there is potential? And do you think, as policy, we ought to be able to allow the researchers at the University of the West Indies and other research institutions to undertake this research so that we may be able to get some kind of competitive advantage in the pharma industry?
From my viewpoint, the answer to your question is a resounding yes. The basic part of the scientific work there is capable of being done in the pharmacy school and the Department of Chemistry at the university. And I have to say that the idea of doing clinical herbal research is not a strange one at all, because you will remember that he and I were on a committee when Johns Hopkins was here about 10 years ago. That was looking at herbal research. We were looking at a herb that could be used to treat hypertension. I think the funding was cut at some stage later on, so the research never got off the ground, but it is certainly possible for us to design such a trial here and test the substance when it reaches that stage.
Professor, I raised the issue. When I looked at the Hebrew University of Israel, I have found, and I've looked at some of the research that they have done there, they have been able to generate a lot of marketable products based upon the cannabis research. Now, what prevents you, as the Dean of the Faculty of Medical Sciences, from encouraging some of your bright researchers from pursuing this research, so that, promising as it is, what prevents you? Is it legal? Is it money? Is it the overarching state apparatus we have? Is it that you don't think that you have the researchers capable of doing it? What prevents us from taking advantage of the competitive environment that we have in growing cannabis to market it and what could be done at the level of the state to overcome the constraints that you face at the university?
Well, nothing prevents us right now. It just requires interest and funding opportunities.
Okay.
That's all.
What about...
with regard to legality, we would not undertake such research unless we have permission of the ethics committee. So the matter, the research project needs to be submitted to the Ministry of Health's ethics committee. From a research point of view, I don't see a legal issue there.
All right.
I think if you want to try it out, then.
Professor, are you saying if you were to prepare a research proposal and you will send it to the Permanent Secretary, Mr. Madre, for sight of his ethics committee, that you will be able to conduct the necessary research and you will be able to obtain the types, the specimens and so on to conduct the research so that the outcomes will be scientifically acceptable?
Yes, we have that capability.
Okay. Yes. Ms. Como, you want to come in?
Yes, I was a member of that same committee that Professor Simangal is talking about. And one of the problems we identified was the availability of the raw material. So, and I know that Waterloo started a program to start growing some of these herbal plants so that they can actually have a source of the raw, because what they call wild crafted, that is to get the raw material from various parts of the country. It's unreliable. There's a lot of variety in it, and that is the first step to the standardization, is the availability of the raw material.
Okay, Ms. Como, I just one follow-up question, and that is, of the range of plants, say, growing in Trinidad, wild and cultivated, do you think you have a full sample of the genetic material in the herbarium?
Well, I recently published a complete checklist of the vascular flora of Trinidad, and we have over 3,600 species of vascular plants in Trinidad and Tobago, of which in our survey with Professor Clement, we found 900 species that were actually being used for medicinal. So to be exactly in this survey, we...
And with respect to cannabis in particular,
no.
Do you have, in your opinion, the range that we have, the genetic range?
That will have to be the research base to work on. We will have
okay, so you will have to compile it. But you are saying that there are companies which are interested in the genetic stock that we have.
There was one government that was interested.
Okay, don't mention the government.
No,
I could imagine which government that is.
I
yes.
won't.
Mr. Chairman,
right.
I think I missed my turn.
Yes, we have Professor Jayaraman.
Thank you, Chair. Yes, we have certainly the capability to do this kind of research, and we are late. My worry is we should not be too late. Okay, cannabis does not belong to North America. It's all went from down. Okay, they have established plenty. Okay, and we are already too late. So, but this is the right time where we have to open up. So the biggest stumbling block in doing this is the legality. So I'm really suspicious if we are allowed to do this type of research. If you say it is possible, what we need is some money, some funding. Some funding is enough just to either characterize whatever that is found in that particular type of medication, or we just prepare our own and then try. But I'm not talking towards the clinical trials. So that might be trivial, but that should not stop the research, because the research we have to gather the evidence and knowledge, that we can do.
Well, so you're recommending then that, as per Ms. Como's submission, we try to collect the full range of samples in Trinidad and Tobago. We could engage in research and propagating them, and we should get the legal permission for your department to undertake the necessary research so that we can see where, if any, opportunity can arise for Trinidad and Tobago in producing drugs like Epidiolex.
Exactly.
Because they are not only Epidiolex, there's Kesamet and all that kind of thing that is coming from it.
We don't need to copy, sir. We can try something else.
Right.
But
Very
we
well.
have the product. We have the material here.
Okay. Yes. And before I go to MP Jennings-Smith, I need to get the pharmacy board. Suppose a medical doctor presents to you, presents a patient with a prescription for Epidiolex. Will you in the pharmacy board be able to stock that now since it is cannabis-based?
Yes, well, we continue to stock what the Act refers to as dangerous drugs, better known as narcotics. So pharmacies do obtain a license from the Drug Inspectorate, through the Drug Inspectorate from the Narcotic Committee. So we have, yes, these double lock cupboards. We don't have that much cocaine again. We do have morphine and a high strengths of codeine, which are classified as narcotic. So the pharmacist, I think, is one of the only bodies that is legally authorized to store narcotics. So as long as the drug ends up being registered through the Drug Advisory Committee, upon recommendation of the Drug Advisory Committee by the Minister of Health, and it is legally available in Trinidad, it may well be classified as a narcotic. We have license to store it under secure conditions. We do presently store them, and we will dispense.
Okay.
And just want to mention that under the same Section 4 of the Dangerous Drug Act, there is no legal impediment because the Minister of Health can grant licenses for cultivation, gathering, importation, export, storage, and so on. So there is no legal bar at this point to even cultivating.
Right. Ministry of Health, I need to get clarity on this position. The clarity is this. Someone is coming into Trinidad and Tobago and that person has an epileptic child and the person is coming in with Epidiolex. I'm sure you could Google it right now. Will that person be allowed to bring that medication prescribed by his doctor in Canada or the United States in Trinidad and Tobago? What is the position of the Ministry of Health on that? I need clarity on that. Yes, the Herbal Subcommittee's representative?
Sorry, we have to look at the fact that it's the medicinal marijuana is not the full cannabis plant. They're genetically modifying it with the THC and the CBD component. So when I personally spoke to a narcotics officer, because I wanted to find out the same thing, he said that once they were assured that it was used for medicinal purposes and it was more CBD than THC, then they would not classify that as an illegal drug, because that's what we have to look at. It's not just doing a research on what we have growing in our genus and our different species of marijuana, but the fact that this is research going on where they're actually genetically modifying these plants and going with the THC CBD component, and that's what these clinics are doing to treat different
accepted, but illnesses. What I need clarity in the public interest is this. In Canada and in the United States, particularly in Canada, these items are prescribed. Many Canadians hold dual citizenship with Trinidad and Tobago. They may be ill, they are traveling, there is border control. They are coming in with one of these medications that may have some question marks on it because marijuana is still illegal in Trinidad and Tobago. Mr. Rahman says there is nothing preventing his members in the pharmacy board from stocking the items because they do stock the certain things which are there for therapeutic purposes. What I'd like to know is that if someone is coming from with a prescription from a bona fide registered medical doctor abroad, and he's coming to Trinidad and Tobago and must cross the border, is he going to find himself in legal problems after looking at his health? Mr. Madre, you're the PS, and I need a clear answer on that.
All right, the issue of registration is separate from the issue that you're currently describing.
Right.
And we will have to research this and respond. We don't know the answer.
Please, we would need, and because this is only the beginning of the hearing, we need clarity because Mr. Madre, we are looking at the health status of the population. And you see, my concern is, it cannot be that someone is not going to get better or be administered his treatment because the law says this is illegal. I think the medical doctor, the medical practitioner must have the sole and final say with respect to, because the patient is under his care. If he says the patient needs this, who am I as a legislator to say you can't give your patient that? So I would like to get the policy position of the Ministry of Health, particularly with respect to these medications which are approved abroad, but which may have some question marks in Trinidad and Tobago. I know we got the position from the Herbal Subcommittee that the thing may have less of more CBD and less is it THC? Less THC. So there is no narcotic effect. There is more palliative, more caregiving. But who is to inform the customs officer, you see? And yeah, right. Could we then request the policy position in writing so that we can follow up subsequent? I'm sure you will get the input of the Immigration Department, you get the input of the Ethics Committee, the input of the Medical Board, the input of the researchers at the university, the input of the herbarium, so that ultimately the Ministry of Health is concerned about health. And anything that interferes with health, Mr. Madre, is your concern. So we do need to get a policy position on this. Hopefully, could we get that within a week? And afterwards, Member Jennings Smith will come in. Mr. Madre, could we get that? This is important.
All right, so you're right in indicating that a number of agencies and a number of pieces of legislation may be involved here, inclusive of legislations that are not directly under our remit. For example, the Customs Act.
Yeah, because
so we'd ask for a bit more time than that, and let us try to commit
because you see,
2 weeks.
Member Smith has to come in, but really what the Herbal Subcommittee representative has indicated is that there is one item called the cannabis plant, but out of it there are many derivatives. And the derivative, which is the CBD, is one that seems to be benign, and therefore, if that is the basis of medication, we would look to get recommendations with respect to legislative changes so that we could improve the health status or protect the health status of the population. As a legislator, it would be irresponsible of me if I did not look at the laws in Trinidad and Tobago which are undermining the health status of the people of my republic. Ms. Jennings Smith?
Is sufficient law there to protect the, and I brought it up earlier, under Section 4, and Mr. Andrew, yeah, you alluded to, you explained it quite clearly. What I want to know, because I asked the question specifically to know, with respect to the CBD, right, and the cannabis, I asked the question specifically to know how you all go about collecting your item to do further inquiries, and the answer I got was that no approval has been made and nobody ever applied. So I want to ask a question. Tell me, how do you get, because you said that you'll have a license to store. Where do you get it from? And what license covers the importation and control and regulation?
Well, there are separate licenses. So we have a license to store and distribute, which is a license we get from the Ministry of Health, signed by the Minister of Health, in relation to securing items for research. There is no bar to applying for this license, but it would be a license to cultivate or a license to import. And that is the route by which researchers can use to obtain the samples to test. So our license at this point, all pharmacies have a license to store and distribute, and indeed stores and distribute a variety of narcotics in the pharmacies from a license issued by the Minister of Health.
Is there a monitoring officer who checks and see who it is dispensed to from time to time?
Yes, the Drug Inspectorate is the body charged with that from the Ministry of Health.
I'm good.
Senator West has a follow-up.
It's not a follow-up,
Okay.
actually, it's a completely different
Very
question.
well, completely different, Senator West.
Two questions, in fact. The first one is I would like to get a sense from the individual who's here in lecturing on avian medicine, how his discipline fits into our discussion, because I'm completely at sea on that score. And secondly, having met fairly frequently within the last 3 or 4 months with the University Grants Committee, I get a sense that the university does not have a business focus. So you do your research and you have a lot of good information and material, but there's nothing that takes it beyond that step. So am I wrong in that conclusion? And if I'm not wrong, what do you need to move to the next stage? So those are the two questions.
Take the second one and we will come into the first.
You're quite right in what you said, that the university has not traditionally had a business focus because of how we were developed. We were developed to respond to the needs of the Caribbean people through public issues and to educate people out of poverty. And it was a Caribbean focus funded by the governments. So there wasn't a motivation to sort of... However, we are changing that, and our new strategic plan for the next 5 years has focused on entrepreneurship and innovation. And we are looking to patent our research. So we are moving in that direction. And we now have a business development office on each of the campuses. So we are moving that way, and it was a question of focus, and we are doing that. So I think I've answered that one. But the other one is very important.
Thank you very much. Professor, are you aware of whether any patents were ever issued to the medical faculty for any of its research thus far?
There are no, as far as I know, no. Okay. There have been patents.
So then that's a challenge now for the medical faculties, given the fact that Professor Clement and Professor Jayarama have indicated that we are in an area of low-hanging fruit with respect to plant medications.
That's right. Yes.
So I think that will be the challenge of the researchers now at our institutes. But avian medicine?
Okay. How does avian medicine fit in here? We may all be a little bit confused. I am actually here as a replacement for a colleague of mine who was supposed to be here but had to be away. So I was asked to replace her. So I'm here, Graduate School of Veterinary Medicine, as invited by the dean. So my discipline is avian medicine, but that's not what got me here. It's just that.
But Representative, from what I know, you're avian medicine, and it's the first time I'm hearing of the field, and I'm grateful that you are here. Welcome. But from the deliberations, is there anything you would like to add that would edify us with respect to non-traditional medicines from your perspective of avian medicine?
Well, I'm first of all a veterinarian who just specializes in avian medicine. And perhaps I should point out that alternative medications are also used in veterinary medicine. And the same risk associated with the use of these medications in humans also apply to the use in animals. So therefore, any sort of regulatory controls that are being considered for human medications should also be considered for veterinary medications, because the same risk apply. We have drugs being imported without the kind of controls some of us think should be applied, and the risks are also there.
On that. Importantly, from our perspective, these herbs or whatever you use in animals enters the food chain. They come up to the human beings. And therefore, it is very, very important that if we regulate for humans, we regulate for the animals in our environment, because it's one health.
Thank you very much. Just a follow-up now, since we are dealing with vet medicine, and I know the Vice Chairman wants to come in, but has anyone ever done any research on neem leaves? Because it's agriculture. I understand neem leaves can provide the basis for organic pesticides. And I also understand that there are companies abroad which have been looking at Trinidad and Tobago's neem with some interest. Did anyone ever do any research on the medicinal aspects of neem? I know it has some benefits with respect to the non-toxic pesticides. And that's again a possibility for commercialization. Any research, any information on neem? No? Okay.
Yes, Mr. Chair.
All right, so there seems to be some research on neem.
Over the years, the staff member at the School of Veterinary Medicine, we have attempted to document what local herbal preparations are used for treating animals. What are they? What species and for what purposes they're used? Neem was among those we discovered to have been used, and it has been used for controlling ectoparasites in various species of livestock. We have also shown, based on examined literature, that neem does have compounds that can scientifically support its use to provide control of ectoparasites in chickens, etc.
Thank you very much, avian specialist. Your presence here is very much appreciated. And so I would ask Vice Chairman to come in. He has a burning question.
No, I just want to follow back up on the cannabis issue. Now, again, we need to be careful in that we are not only speaking to ourselves, right? We are speaking to the public. Cannabis versus marijuana. Cannabis is the term, is term what? That's the scientific term?
Yes. It's a scientific name.
Name. And marijuana is the
common name.
Is the common name, right? So we are talking about marijuana also, right? In your document submitted to us, Professor Clement, right? You identify on page 3, you identify that cancer is the major disease worldwide, and you went on to identify some herbal remedies, soursop. You talk about, the percentage, 80.7% using the leaves, the bark, the fruit. You went on to talk about aloe vera, beetroot, papaya, carrots, and so on. The cannabis talk came up, and as we say, cannabis is illegal in Trinidad and Tobago. All right, but we have sent on marijuana, whichever word we want to use. Probably I should use marijuana because I think that's the term that I am accustomed to in terms of Trinidad. All right, we want to identify to say, listen, in your report, you have said that these herbal remedies, nowhere in your report I think I've seen cannabis mentioned. I'm thinking nowhere, all right? But in terms of going forward, the importance of marijuana to be used as an alternative health source versus the other herbal remedies, pawpaw, carrot, beetroot, soursop, and so on. All right, so we are saying that we want to look at it in the terms of the emphasis. Why the emphasis? Marijuana cures what?
Well, to answer member.
Or assist in curing what?
Well, what I mentioned here in the report is the major herbs that were used, major herbs and foods that were used. But we did find that a couple of people did use marijuana. And we are not sure whether people did not indicate that they used it because of the place that it was. Maybe they were in a hospital setting and they didn't want to indicate. But there's a very small amount of people who actually indicated in the hospital that they use cannabis or marijuana to treat cancer pain. But it was not included because it was a very small number.
Okay, from your research, would you say that marijuana, in terms of what we need to do, we need to get the framework in place from the Ministry of Health. We need to get the framework from whether national security and so on in order to determine, to get the various strains of plants that they would need in order to do their synthesizing and so on. In terms of going forward, the logistics to get there, you see it as being feasible versus looking at other sorts of remedies, herbal-based?
Well, I believe it's feasible because there's evidence from elsewhere that indicates that cannabis or marijuana is useful in people with certain conditions. Cancer is one of them. See, the pain of cancer, people use it in other parts of the world to treat cancer pain.
Yes.
Okay, one other question. Away from that topic,
We are at 12:24, and I do have to truncate. We want to finish at 12:30. So we will hold it for the second round of questioning we have.
But let me get this one in, Mr. Chairman.
It has to be so short.
Yes, it has to be short. It will be short.
And a short response is requested also.
And again, in terms of Dr. Jalsa, right, Dr. Jalsa, is there a deliberate attempt by the powers that be for us to remain synthetic based in our medication going forward versus herbal based?
Deputy Chairman, sorry, right? No, there is not a deliberate attempt at that, I would say that. It happens so that what we start with from the plant, we can improve its efficacy and lower its toxicity. So it's not a deliberate attempt to stay synthetic. It happens that the synthetic variants have shown to be better and more controlled than that mixture isolated from the natural products.
We will have to bring closure at this point. Yeah. Before I do so, let me give a rundown of what I have learned this morning that I did not know before. And I can say I'd imagine other members of the committee. It was made very clear that non-traditional medications have traditionally been the basis of traditional treatments. We started non-traditional and we move into mainstream. And we are seeing that across the board. It was advanced that Trinidad and Tobago may very well have the competitive advantage given the resource constraints that we face with respect to plant-based medications as low-hanging fruit, as opposed to the chemical-based and the gene-based medication as produced by the large farmers abroad. It was drawn home that we do have intellectual property in Trinidad and Tobago, embodied in the research that we do, and embodied in the stock of assets held at the herbarium in Trinidad and Tobago, that international commercial enterprises, seeing huge opportunities in international pharma, would like to obtain, and we need to protect our intellectual property. The reason for that is very simple. When we need their intellectual property, we have to pay for it. So that we need to protect our own intellectual property, our own research, and we need to, of course, strive to market our intellectual property that is commercializing that property. So that, and on that point, there is a position advance that we need to collect and store before we lose the items, the range of all plants that we have. I did not ask anyone about the datur plant. I know it commonly as datur, but I understand it does give someone a hallucinogenic effect. So it may have something in there. But in particular, we want to collect all plants that have the potential, as Professor Clement and Professor Simongal indicated, to generate the opportunities for us in the field of pharmacology. So we would hopefully have a collection of all the species which are available, in particular, the range of cannabis species that we have. The reason I say this is simple. We produce the best cocoa in the world, not the best coffee for whatever reason, but the best cocoa based upon the peculiar conditions in Trinidad and Tobago. It may very well be that we have existing, given the climate of Trinidad and Tobago, a particular type of marijuana plant or cannabis plant that could be produced in commercial quantities and exported to some of the countries abroad who are asking Ms. Como for samples. So let us not let that opportunity slip. We need to regulate the non-traditional forms of treatment, as the pharmacist, Mr. Rahman, indicated, that there are many supplements which are supposed to be that, supplements and cooperating treatment. They coexist together with mainline treatments. So someone can be taking metformin, glucophage for diabetes, but he may also be taking some herbal supplements for it. There is one I know that works, I shall not mention what it is. It is called Karaili. Crushed Karaili works for me. Raw crushed Karaili does not taste good, but it lowers the blood sugar in addition to the metformin. And therefore, research should be done on that. It's called bitter melon abroad, but we need to do the research. Metformin alone may not do it, but I can't function without the metformin. But metformin and Karaili, I could eat chicken and chips all the time. We need, and therefore, you see, we are looking at the health status of the population. Something that I like, that I can have only once a month, but really, without the Karaili, I can't have it even once a month. There is a position that, given the opportunities available for Trinidad, and given the intellectual expertise as per the research papers that you have produced, which I have found very impressive as an academic myself. I am very impressed with the range of research that you have done and the type of output that you are doing. But I think that we need to be looking, as Minister West said, with joint ventures with pharma companies so that we can bring to market your basic research that is done on the lab while protecting our intellectual property. There are many models around, and I'm hoping that the university will have a business office that will work closely with the researchers. So the moment you present a paper to rave reviews, that particular paper will be made available to the international pharma companies, big, small, and medium size, so that you can work in conjunction using their resources, your technical expertise, and revenue sharing formula, diversifying the economy of Trinidad and Tobago. I was very glad to hear that our herbal subcommittee specialist was trained in Cuba. Cuba has a very, very well-developed pharma section, and so there may be a role for the Cuban expertise to work with the Trinidad expertise in developing and bringing to market the research that you are doing. We were advised that the pharmacists are all trained to advise on over-the-counter medication based upon the modules that are offered at the school, at the medical school, at the university. We were advised, so therefore, the pharmacists should be able to advise now anyone who sees over-the-counter medications what, in general, they can be used to assist in, not as a cure in, but to assist in. And I think Mr. Rahman made a very valuable point. These over-the-counters are meant to assist, not a second-line treatment, not as a first-line treatment. We were told that there was an ethics committee in the ministry. I was not aware of that at all. There is an ethics committee that will have to work closely when we are pursuing cannabis research. We were advised from the herbal subcommittee specialists that we are making a clear division between the CBD and the THC, and we want to see to what extent legislation can be amended so that the medicinal effects can in fact be identified. Plants which are concentrated with the CBD can in fact be grown in Trinidad, may be exported abroad. And I know it's the Muscovado bias, where we simply export the plants for processing abroad, but at least it will add to our foreign exchange if we are able to find a particular species high in CBD using Trinidad soil. So you may have to work with the Ministry of Agriculture together with the health specialists to identify that, and together with the herbarium to identify what is the opportunity lying there. We do need to have, and the Ministry of Health said they need 2 weeks. I thought they would have had a week already. Since I very boldly came out in the public domain a while back, they should know that I'm coming to the committee with this. What is the policy on cannabis-based medication, especially since it is established abroad? People abroad suffer the same ailments like people here. We want to protect our citizens, no different from them. We would like to know what is the policy and what are the legal impediments which ought to be navigated so that you can implement the policy to protect the health status. Mr. Madre, I know you have a familiar face in the committee. That is going to be a responsibility of the people in the Ministry of Health to investigate. And we were also told that pharmacists in this country are given licenses to store items which are controlled. And therefore, if pharmacists already have that license, we know that as we move forward in Trinidad and Tobago, we can take advantage of the opportunities abroad with respect to medicines produced abroad to assist cancer. We are going to have an oncology unit. I would hate to think that when we have an oncology center, that the oncologists there are constrained in prescribing medication because of laws. If the oncologist says, I would like to prescribe cannabis-made medication for my patients, I would like the oncologist to have the final say and not the legislators. So that this is what I have come away with this morning. This has been one of the more productive hearings. In fact, our committee always has very interesting investigations. After all, it's our committee, and we are boldly looking at how to protect the status and the welfare, health status and welfare of the people of the Republic of Trinidad and Tobago. At this point, I would like to obtain closing remarks from the representatives, and I would start with Mr. Madre of the Ministry of Health.
Right. Thank you, Chairman and members. The discussions has been have been enlightening, and we shall certainly make use of the information that we have learned. As I've indicated, we will provide you with a response on the Epidiolex drug within 2 weeks, and if we can do so much earlier, we shall certainly do so. And finally, as a non-doctor, please take my advice and stop eating so much chicken and chips.
Much, Mr. Madre. I try to have it once a month, so you're saying once every 3 months. Mr. Simangal.
Yes, Chair, thank you, and thank you to the committee for inviting us to make our views known to you. I thought it was a very stimulating morning, and I do say the questions were challenging, and thank you, all of you, for your interest.
Very much, Professor Simangal. Professor Jayaraman.
Thank you, Chairman. I'm very happy to be here and also listen to the diverse views. And as a scientist, I must say, we do not need to reinvent the wheel all the time because there is abundant of literature available. We have a free access to all of them. So we need to have, even I suggest, a subcommittee or some kind of forum which can just peer review all the literature and then give a scientific output, a kind of recommendation on these things. And another thing is, we have enough capacity to do the research at our place, and the culture of research has to be supported. And I don't want to talk more about it. You know, there are countries which are investing a certain percentage of their GDP to research, and in the same way, we need to think about emphasizing research, and that has to happen in our institutions instead of borrowing things from outside. This is one way how we substitute the importation. Yes. Thank you very much.
Thank you very much, Professor Jayaraman. And Mr. Rahman, finally, your closing remarks.
The opportunity to give information on the use of herbs. I'm hopeful that it is more widely disseminated because we need to get people's ailments treated properly.
Thank you very much, representatives all. It is 12:37, 7 minutes past the scheduled time, but this morning's session has been a very, very informative one. And I am indeed very grateful on behalf of the committee for the participation, the open discussions, the investigations of the issues, and for assisting in charting a way forward. This is not the end of the matter. This is the beginning of the discourse as we try to diversify the economy of Trinidad and Tobago, as we attempt to take advantage of our natural resources, as we exploit the low-hanging fruit as indicated by the researchers, and as we look after the health status of our population. As members of the committee, our job is to take in the evidence and also to examine whatever laws exist in Trinidad and Tobago, which may need to be amended so that the health status, the welfare, and the development of Trinidad and Tobago can proceed without legal impediment and without the impediment. So making use of all the expertise we have in the country. I bring this session to a close this morning, and I thank you all for your participation. Have a good afternoon.
Thank you.